know who needs to hear this today, but somewhere along the lines, we lost the fact that birth was never meant to be convenient. I don't know where it became the norm, where we could just induce on a Monday because we didn't want our baby born that Saturday, just for the heck of it. But like, to each your own. Do if that's what you choose to do, you do you, boo. But like, you need to understand that if you do that, like, accepting that there are probably going to be some repercussions with it, because when you induce just for the sake of inducing, like, not medically necessary, but like because the date works better for you, you're just someone who wants to have your baby born on a day where you know when you're going to have it born. Our babies weren't meant to do that. Like, our bodies aren't meant to do that. There's going to be factors that come along, risks that come along with choosing to force your body to birth that baby that wasn't ready to be born yet. It's so crazy to me that so many OBs out here are just saying, like, oh yeah, because you're 39 weeks. Like, the other day at my appointment, I had mentioned that my due date is July 3rd, which is almost the 4th of July. And I was like, yeah, it might be kind of crazy having a 4th of July baby. And she's like, well, if that concerns you, we can go ahead and induce you at 39 weeks. And I was like, I didn't ask for that. I'm a firm believer that, like, you do what you want to do for your body. Like, I'm not going to tell you to do something different. What bothers me is that there's just no like upfrontness about it. You have to know to ask, like, what are the risks of me being induced early? Just because, like, it's not because I have preeclampsia, it's not because we have a risk involved. Like, it's just, you can induce if you want to induce. Your OB will just tell you, like, yeah, sure, let's go do it. Like, there may be some providers out there that will educate you, but a lot of them don't. It's just about being, like, aware, because when you have your baby, no matter what, like, if you're choosing to go unmedicated, when you do that, like, you don't really know how long your labor is going to be. Like, there's that, again, that factor of, like, okay, it's not as predictable. That's where the trade-off is for me. Like, I could go into labor right now, but my baby's not going to be born till tomorrow, or it could be born in a couple hours. I don't know. But then when you choose induction, same kind of thing. Yes, you're choosing the day and time you're being induced and knowing that your baby will probably be born within 24 to 48 hours, but you could still have a very long labor, especially if you're being induced early. There was no need to be induced. It could lead to a C-section because you're having a lot of interventions happening. Your body may not be ready and you're just trying to push. So it could lead to a C-section. Even if you chose a C-section, elective C-section, maybe you wanted to go that route. There's also risks there because, yes, you chose to have a C-section, you know what date and time that is, but then there's the longer recovery, right? You have the scar, you have scar tissue, all these things. So each birth, you have to just know that there's always pros and cons to any route you go, but what's important is being educated on, like, okay, make your choice and stand in it because you were backed, you knew what was going to happen, and you just understood the repercussions.